Hello, welcome back again to this channel where we talk about the basics of medical information making a big difference. Kindly, if today is your first time, consider to subscribe. And if you are a returning subscriber, thank you so much for always checking on this channel. My name is Rebecca Morangi. In the next few minutes, we are going to see how you can manage GERD at home without medications. If this condition becomes worse or chronic, it will need attention from medical professionals. The first thing to do is to avoid foods and drinks that trigger this reflux. We have those who use caffeine, those who use chocolate, we have peppermint, and there are those who take fatty foods. We mentioned of the causes of acid reflux. Fatty foods, we found that fatty foods contribute a lot to this condition. Even alcohol triggers this condition. Another point is to avoid tight-fitting clothes. Tight-fitting clothes, actually what they do, they put pressure on your abdomen. In return, it causes this reflux. Another thing to note is to eat your food slowly and chew your food thoroughly. There are some people who take food, they don't even chew, they just swallow the big lumps the way they are. Chewing food will help even the digestion process to go on smoothly. It's not good to be in a hurry when you are taking food. There is time and season for everything. Remember, your health also is very important. So take your food slowly, chew your food, put your fork down, chew food, swallow, and then take another. Another point to note at home is don't lie down immediately after taking your food, especially at night. This condition mostly happens at night. You are supposed to take at least, medically, at least 3 hours after taking your food. That is when you can sleep. The next point is to maintain a healthy weight. We mentioned the cause of acid reflux as somebody who is obese. We are overweight. It's good to check our BMI, body mass index. Sometimes many of the people, we don't even know that we are overweight. So when you are overweight, what happens? You put a lot of pressure actually on the abdomen, which will put a lot of pressure on your stomach. And then what will happen? This condition will be accelerated. Check on your weight. Weight contributes to a lot of medical conditions. You can connect that. That is why you are told to check on our weight. Another point is to avoid smoking. What happens to the lower esophageal sphincter muscle when you smoke? It loosens that muscle. We said that muscle is supposed to relax, to allow food to enter, and then it will close automatically. When you smoke, you loosen your lower esophageal sphincter muscle. Kindly check on your lifestyle. You may be an active smoker or a passive smoker. Nobody is spared here. Either of the two, you should check note of that. But I know smoking and alcohol can be avoided for the sake of your health. Another point to note is sleep on an elevated angle. What do I mean here? Your head should be slightly elevated. And when you elevate your head, it's not only this part, you start from your waist up. Putting a lot of pillows on your head, they are not encouraged. Some people use stones, block stones, to elevate their beds. Another point is to eat small meals at different intervals. If you take large amount of food at one time, you will put pressure on your stomach. That pressure also, remember the angle between the esophagus and the stomach. There is the lower sphincter muscle. So the muscle will be weakened by the pressure from the food you have already taken. So eat small amounts of food. And the advantage of eating small amounts of food, digestion happens very fast. So it's good to take small amount of food at intervals. Sometimes when women go to clinics when they are pregnant, many of them present with this condition of acid reflux. They are told to, because remember, the fetus is growing. When the fetus is growing, puts a lot of pressure on the stomach. The stomach is squeezed. So there is no enough space for somebody to eat a lot of food. You eat small amount of food and then you feel that your stomach is full. So that is why we are saying when you eat large amount of food, you put pressure on your stomach, and then the lower sphincter muscles will be on pressure also. So that is why we are encouraged to take foods in small amounts to aid in digestion. So digestion will happen faster and this condition will be minimized. It's better you eat well in the morning or in the midday and then in the evening, because you are going to sleep, you just take something light. Another point to note is to sleep on your left side. When you sleep on your left side, the esophagus will be on the upper part and the stomach will be on the lower part. So there is no pressure. Always, if there is gastric acid in your stomach, it will remain on the lower section. And sleeping on the left side has got many advantages when it comes to blood circulation, removal of toxins from the body. So sleeping on the left side has got many advantages, but now when it comes to GERD, it will help you because always your stomach is on the lower side and the esophagus is on the upper part. Up to this point, I believe we have gotten something on how to manage GERD or acid reflux at home. We started by mentioning to avoid foods and drinks which trigger this condition. We have mentioned of putting on or wearing clothes which does not put a lot of pressure on your abdomen. When you sleep at night, We are referring at night because most of these conditions, or most of the time when you have this acid reflux, it happens at night when you are asleep. Remember to take some time. Don't lie down immediately after you have eaten. We have mentioned of eating your food slowly and chewing your food thoroughly. When you chew your food thoroughly, you will help even the digestion process to move faster. When you swallow food, lumps, full of lumps, your digestion process will go slow. And actually, whatever you're doing, you're encouraging the digestion process to go for a longer time. So chew your food, help your body to digest food faster. Take time when you are eating. Another point you have mentioned is to maintain a healthy body weight. If you are obese, take note of that. Make sure you do regular exercise. Remember, another point to note is to avoid smoking and drinking alcohol. Smoking loosens your lower esophageal sphincter muscle. Another point you have mentioned is to elevate the angle of your bed, your sleeping position. Another point you have mentioned is to eat food in small amounts and at different intervals. Another thing you have mentioned of is to start sleeping on your left side. When you sleep on your left side, the stomach is then on the lower position and the esophagus is slightly above it when we consider the anatomy of the digestive system. The reverse, when you sleep on the right side, the stomach is on the upper part and the esophagus is on the lower side. What happens? You are putting pressure on the lower esophageal sphincter muscle. It's like the lower esophageal sphincter muscle is submerged. So check on your sleeping position. If you have been sleeping on the right position, it's not only women, especially pregnant women, who are advised to sleep. No, everybody, even men, because of the GERD issue. GERD affects each and every person, children, men, and women, everybody. We should check on that. Let's see what happens. If you check on this sketch, you can check the stomach, it's on the lower side, and the esophagus is on the top side. And if there is any gastric acid in your stomach, it will remain there because your esophagus is on the upper section and the stomach it's on the lower part. So sleeping on the left section will help you. There is no pressure. If you can see on this junction where we have the lower sphincter muscle, the lower sphincter muscle will not be affected in any way because no pressure is exerted because of the sleeping position. When you sleep on the right side, let's check here. This is the esophagus, and then we have the lower esophageal sphincter muscle here on this junction, that ankle, that is the lower sphincter muscle. And then we have the stomach. So if there is some gastric acid, when you sleep on this section, there will be pressure on this lower esophageal sphincter muscle, on this junction, and then it will force this gastric acid to move up into the esophagus. So sleeping on the right side, it's not the right option. You can see the stomach, it's on the upper part, and the esophagus is on the lower side. So if you reduce pressure in your abdomen, this lower sphincter muscle will not be able to open. So it's good to sleep always on your left side. By doing that, you will minimize this acid reflux, especially at night. And we have said this condition mostly happens during sleep, when somebody is sleeping. But if you have looked on all this and they have failed to work, remember to have over-the-counter. We have finished by saying have over-the-counter medication. Those are examples of antacids, because the rest are purely prescription medication, which you need to go and get a prescription from a qualified medical practitioner. Assuming you have a reflux, like right now, maybe I've eaten something and then I'm feeling that there is some acid refluxing immediately. What am I supposed to do? Take clean water in a glass and then take a sip. Not, you don't take a full glass, a whole 1 liter at one point. No, you just take a sip at a time. Water neutralizes acid. Thank you so much. We can talk of this acid reflux thing now and again. Some people take some foods which cause this acid reflux thing to happen. I can encourage whatever you take as an individual, and then it affects you. I've mentioned of avoiding some foods and drinks. If you take some food and it causes this acid reflux, the best thing to do is to avoid. I'm not saying stop, because the acid reflux thing, it's not a permanent thing. Because if I tell you stop, 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 at the long run, you'll find that you have stopped taking a lot of foods which your body needs. We need proteins, we need carbohydrates, we need vitamins, we need all around for our body to function in the right way. Remember to avoid anything you take and it affects you. That is the advice I can give. Just avoid for some time. After some time, you may come back to take them. Some school-going children, they always present to a health facility with this condition. Some request to be given letters so that they take to school for them to be exempted from eating some foods. When this condition is chronic, actually, there are some foods you cannot take. Yes, it happens, because if you take certain type of food and it affects you, it's not good to continue. That is why I believe they come or they ask for those letters. So whatever you take as an individual and it affects you, if you can able to avoid. And remember to take note of the many things we have mentioned. Acid reflux is very common. If lifestyle cannot work, go to over-the-counter medication. If over-the-counter medication cannot work, you go for surgery, we mentioned. If you want to avoid all these, try what we have mentioned today. Thank you so much for always checking on my channel, and I'm encouraged. Your views, they help me to push each and every day to keep on bringing this content. Information is power. When you are equipped with information, you will likely make a good decision, be it on your health, be it on any life aspects outside here. Getting the right information will be able to do the right thing at the right time. Thank you so much, and let's meet in the next video. Bye bye.